The Practical Steps Principle is the second statutory principle of the Mental Capacity Act 2005. The principle requires that a person is not to be treated as unable to make a decision unless all practical steps to help them to do so have been taken without success. The principle acknowledges that some people may need assistance to make decisions. It's a conditional clause, and in considering practical steps, requires that you balance risk. As the policy intention of the principle is to promote autonomy, the threshold for risk is high, and the presumption is that all practical steps will be taken to help the person make a decision. Justice Mostyn confirmed this when he said that he believed that issues such as this must be subject to a threshold akin to that of significant harm that's found in the Children Act of 1989. This, he said, has to be implicit in this second principle. In some urgent or emergency situations, intervention can't be delayed while a person gets support to make a decision. In these situations, the only practical and appropriate steps might be to help a person by keeping them informed of what's happening and why. Practical steps include making the person feel at ease. It's important that assessors consider whether there are particular times of day when the person's understanding is better, when their alertness is better. Are there particular locations where the person may feel more at ease? Could the decision wait to see whether the person's capacity would be restored, or whether the person can make the decision at a later time when the circumstances are better for them? The timing of a capacity assessment is also part of the practical steps principle. When assessing mental capacity, you should try to choose time of day when the person is most alert. Some people are better in the mornings, others are more lively in the afternoon or early evening. If the person's capacity is likely to improve in the foreseeable future, wait until it has done so, if practical and appropriate. Some medication can affect a person's capacity if it causes drowsiness or affects the memory. Can the decision be delayed until these side effects have subsided? Crucially, take one decision at a time. Be careful to avoid making the person tired or confused. It's important not to rush. It's important to allow the person time to think things over or to ask for clarification. Where that's possible and appropriate, facilitate that. Avoid or challenge time limits that are unnecessary if the decision isn't urgent. Delaying the decision may enable further steps to be taken to help the person make the decision for themselves. The duration of the assessment is another important element of the practical steps principle. Should the assessment be done on one occasion or should it be done over several visits? It will depend on the person's concentration span. It'll depend on the number of questions that the person has to make decisions about. Remember, decisions about residence, for example, are also likely to include decisions about contact with other people and the support needs of that person, as well as where to live. Rushed assessments or short snapshot assessments have drawn criticism from the courts, as we see in PH and a local authority in 2011. Here, the judge criticises the somewhat superficial report of the neuropsychiatrist, that he was basing his opinion on a single 90-minute interview, and the court concluded that that was a disadvantage. The court had the benefit of two other witnesses who knew the person before he was admitted to the care home and were clear that his lack of capacity predated his admission. The other clinician witness each had valuable expertise in Huntington's disease, and each brought a slightly different type of expertise to the case. This justified the court attaching greater weight to their combined views and their assessments, which had been developed over time with the person. Being able to understand and retain relevant information is a crucial part of the functional test of capacity. So it is important, as part of the practical steps principle, that you're precise about the information in question. Are you satisfied whether or not there is more than one question that needs to be addressed? Should they be assessed separately? Is there case law that sets out what the salient details the person needs to understand are? Remember, the Act says that a person is not to be regarded as unable to understand information relevant to a decision if they're able to understand an explanation of it given to him in a way that's appropriate to his circumstances. So you can adapt the information by using simple language, visual aids, or other means to help the person make the decision themselves. The Mental Capacity Act also says that the fact that a person is able to retain information relevant to a decision for a short period only doesn't necessarily prevent them from being regarded as able to make a decision. It very much depends on the complexity of the decision and the amount of information they are therefore required to retain. In the heart of England NHS Foundation Trust and JB, a case that we will return to in later videos, the court held it was for the trust to displace the presumption that JB had capacity on the balance of probability. But it was important that the right question was asked. The court found that the trust approached matters on the basis that the woman was unable to clearly show that she had considered the option of an amputation in this case, or that they needed to be certain of her capacity. In one recorded entry, they held that she was unable to fully understand, retain and weigh information. Those formulations, according to the judge, didn't sit easily with the burden or standard of proof contained in the Act. He said what's required here is a broad general understanding of the kind that's expected from the population at large. The person is not required to understand every last piece of information about a situation and her options. Even her doctors wouldn't make that claim. He also said it had to be remembered that common strategies for dealing with unpalatable dilemmas, for example, indecision, avoidance, vacillation, shouldn't be confused with incapacity. We all do it, and so it isn't a sign of incapacity. Crucially, the judge concluded, we shouldn't ask more of people whose capacity is questioned than those whose capacity is undoubted. The need to retain information is not a strict memory test. Aids to retention can be used. The Code of Practice to the Mental Capacity Act tells us that whilst the person must be able to hold the information in their mind long enough to use it to make an effective decision, we mustn't rush to the conclusion that a person lacks capacity because they can only hold the information for a short period. It depends on what's necessary for the decision in question. The Code of Practice goes on to say that items such as notebooks, photographs, posters, videos, and voice recorders can be used by the person and referred to by the person to help them record and retain information. And this should be encouraged by you as an assessor. When you're helping a person to make their own decision during a capacity assessment, you have to consider is sufficient information being presented in a way that gives the person the best opportunity of understanding. Is it enough for you to simply describe options to the person? Does the person perhaps need to experience it rather than hear about it or read about it? Would a short placement in a care home help them make a decision about whether they wanted to live there? If the person is struggling with English, is an interpreter required? Is the person being given sufficient time to consider their options? Would the person be able to make a decision with the benefit of repeated presentation of the information and a discussion. Is the person free from influence or pressure so that they can consider whether they want and what they want rather than what others want of them? Are you able to assess that person away from the home environment, or is it better that the person's assessed in that home environment or on their own or with an independent person to help support them? Are you satisfied on balance that the person is able to show what they want, so that even if the person can't explain it, they may be able to show their likes and dislikes by the way they behave in different situations? Do you need someone with a particular skill who could assist in working out the decision and presenting it to the person, such as speech and language therapist, a psychologist, a more experienced health or developmental worker? Have you approached a speech and language therapist for a communication strategy? Is there someone who knows the person well and understands them and could assist? Have you given the person an opportunity to review and comment on what's recorded and to write down or express their own views? And it might be that you need to consider some education for the person to try and improve their understanding, a tailored training program for the person to provide information for specific decisions. These have been used in sex education programs where a person's ability to consent to sexual activity is in question. Medication management programs for people with chronic conditions such as diabetes. Preparation for dental treatment where booklets are used showing the procedure, and videos are used showing the procedure to help prepare the person and improve their understanding. An extract from the NICE guideline on assessing decision-making capacity stresses the need to support decision-making, and to do that effectively requires a collaborative and trusting relationship between the assessor and the person. They emphasise that assessing capacity is not about trying to persuade or coerce a person into making a particular decision, and it has to be conducted in a non-discriminatory way. Assessment also requires you to understand what's involved in a particular decision and to understand what aspects of decision making a person may need support with and why that might be the case. It's also important to be person-centred, finding out from the person how they want to be supported in their decision making. So you need to take a personal approach, accounting for any reasonable adjustments and the wide range of factors that can have an impact on a person's ability to make a decision. This would include the person's physical and mental health, the person's communication needs, their previous experience or lack of experience of making decisions, the involvement of others, and being aware of the possibility that the person may be subject to undue influence, duress or coercion regarding this decision. The situational, social and relational factors in play, the cultural, ethnic and religious factors in play. Cognitive elements, including the person's awareness of their ability to make decisions, emotional and behavioural factors, or those that relate to the symptoms of their physical or mental condition. What effect are prescribed drugs or other substances having on the person's ability to make decisions? You need to use this knowledge to develop a shared and personalised understanding of the factors which may help or hinder the person make a decision, which can be used to identify ways in which the person's decision making can be supported. It's important then that when providing information to support decision making, you are able to clearly determine what information covers the salient details of the decision that you are supporting the person to make. That you offer tailored, accessible information to the person who is being supported, that you do so in line with the National Health Service's Accessible Information Standard. You'll need to support the person to identify, express and document their own communication needs and to ensure that options are presented in a balanced and non-leading way. When supporting people to communicate so that they can take part in the decision-making process, it's important that you consider involving significant or trusted people in supported decision-making in line with the person's preferences, and that you have due regard for the principle of confidentiality that's set out under Section 315 of the Mental Capacity Act Code of Practice. You need to ensure that this support is free from coercion or undue influence, and to give people time during the decision-making process to communicate their needs and feel listened to. Be aware that this may mean meeting the person for more than one session. It might be necessary to refer to other services such as speech and language, clinical psychology or liaison psychiatry that could enable the person to make their decision when their level of need requires specialist input, such as when the person's needs in relation to decision making are complex, or if the consequence of the decision would be significant. For example, a decision about a highly complex treatment that carries a significant risk. When considering whether the information you're going to provide a person is being provided in an accessible way, you have to consider the legal context. Under the Equality Act of 2010, you have a legal duty to take steps to make reasonable adjustments in order to avoid putting a disabled person at a substantial disadvantage when compared to a person who's not disabled. So the Act requires information to be in an accessible format as a reasonable step to be taken. Similarly, the Social Services and Wellbeing Act, Wales of 2014, places specific duties on local authorities to provide advice and information. Information and advice must be accessible to and proportionate to the needs of those for whom it's being provided. And of course, your own professional bodies and regulators require standards be met, and these standards include support for communication or understanding as part of codes of performance and behaviour for members, or similar statements of expected behaviour. They also require you to take reasonable steps to meet a person's language and communication needs, and that you provide wherever possible assistance to those who need help to communicate their own or other people's needs, and to use a wide range of verbal and non-verbal communication methods. So the second statutory principle of the Mental Capacity Act that requires you to provide practical steps to help a person make a decision suggests that you need to consider timing of your capacity assessment. Can the decision wait? Is it likely that capacity will be restored? Location. Can you help the person feel at ease by changing location or picking a more appropriate location? Information. Are you providing information about the decision that the person can use to make their decision in a manner that's likely to be understood by them? Is the question one that can be dealt with on one assessment visit, or do you need to have several visits? And have you taken action to take account of the communication needs of that person?